everyone, Alex
and Kelsey,
back again with another CDHF Talks.
Today we are talking with Dr. Turbai, gastroenterologist at the University of Calgary, about a digestive condition that you may be familiar with, Irritable Bowel Syndrome, or IBS for short. IBS is a chronic pain disorder that is very common within the Canadian population.
IBS can be classified into 4 different subtypes: IBS-C, associated with constipation, IBS-D, or diarrhea, IBS with mixed bowel habits, or IBS-U, aka unknown.
The exact cause of IBS is not clear as of yet. However, it is believed that IBS may be caused by one of several factors, which Dr. Turbai will talk about shortly. Through research within the microbiome, we are able to see people with IBS have different populations of bacteria in their gut than the general population. In terms of managing IBS, it often takes a combination of approaches, and each person may be different.
Yep, and Dr. Turbai will be walking us through all of the treatment options available for IBS, such as utilizing the FODMAP diet, antispasmodics, peppermint oil, over-the-counter and prescription medications, as well as some psychosocial interventions such as meditation and journaling.
This is one you definitely don't want to miss, so let's jump right into it.
IBS is a chronic pain disorder, and it's very prevalent, which means that it's very frequent in the Canadian population. Depending on the study, there's been about 15% of the Canadian population that suffers from IBS. Now, that's a lot of people. So 15% of the population have IBS, and there seems to be more women than men that suffer from IBS. We're not exactly sure what's the difference between women and men in terms of gut microbiome, or is it brain chemistry, or they seem to feel it more. We're not sure. There's also a possibility that women may participate more in certain questionnaires, or they may go to a doctor more. So there might be some confounding issues with that. But in terms of frequency, it's 15 to 20% of the population. And there seems to be at least 5 women for every man that has IBS. IBS is a young adult illness. So it's usually between the ages of 20 to 60 that patients suffer from IBS. And there's a big impact on society. Like, patients that suffer from IBS tend to go to the hospital or emergency at least once or twice a year in half. And most patients discuss IBS with their physicians a few times to 3 to 4 times a year. So it's something that is affecting us for work, for money. It's affecting us for visits to the emergency room, and we're often talking about it with our physician. Now, one thing that influences IBS is suffering or coping mechanisms. So there's patients that suffer will discuss it more with their physicians. So there's probably a lot of people out there with high coping mechanisms that aren't talking about it with their doctor, that aren't talking about it with their spouse. They're actually suffering in silence because they're just trying to get through their day.